There's so much to absorb about this new coronavirus, about how to cope and how you can help flatten the curve and slow the spread. Many of you have sent in your questions, and our Jeff Semple is trying to answer them by going to the experts. Jeff, what are the biggest concerns from our viewers?
Well, Robin, viewers have been emailing in their coronavirus questions almost by the minute. And one of the most common COVID-19 concerns, take a look at this viewer email, should snowbirds come home? More than 300,000 Canadians head south for the winter every year and are now wondering what to do. Well, Prime Minister Justin Trudeau was unequivocal. It's time to come home, and medical experts agree.
We've seen a lot of unprecedented things happening, such as border closures, and I don't think those are done.
The only potential hiccups in getting home is that as of Wednesday, only 4 major airports in Canada will be receiving international passengers. And if you arrive at the border showing symptoms of COVID-19, you'll be denied entry.
Oh my goodness. If we start coughing when you get there, like, what do you do?
Now, thus far, the government has been short on details.
There will be some assistance there from the consular point of view and financial assistance.
Jeff, another concern is the testing that's being done for COVID-19. Here's one viewer's question on that.
My name is Carol Patterson. I'm from Victoria, BC. My concern is that there are people coming back from traveling who won't be tested, who could then be going back to work and childcare, because I run a daycare, and then infecting other people.
Well, right now, the answer to the question, who gets tested for COVID-19, partly depends on the province you live in. Anyone showing symptoms who has traveled abroad recently has been receiving the test, but increasingly officials in British Columbia and here in Ontario are focusing less on travel history and more on the severity of symptoms.
Because we might need to avoid testing people who are not sick in order to reduce crowding in these regional test centers or crowding in hospitals.
Anyone who arrives from abroad is being asked to self-isolate for 14 days. Here's a question from a viewer who just arrived back in Canada from California.
I'm Debbie. I'm from New Westminster, BC. How will we know when is the appropriate time to seek somebody from the health department?
In other words, if you've been told to self-isolate at home and you develop symptoms, when should you seek medical attention?
Well, people are having fevers day after day that are not resolving. If your cough is getting worse, if you're more and more short of breath, if you're feeling extremely weak, like you're having a hard time getting out of bed, those are all symptoms that are worrisome.
But everyone else, especially younger, healthier people who develop mild symptoms, are being asked not to go to the doctor, but to stay home, to self-isolate, stay away from others for 14 days and focus on getting better. And in the vast majority of cases, Robin, that's exactly what happens.
We know you have lots of questions about the virus. Our Jeff Semple will consult with experts and try to answer them. So email us at yourquestions@globalnews.ca, and our website has a special page dedicated entirely to the new coronavirus.